I must admit, when I first got the invitation to go along, I thought, oh God, another getting together, have a bit of a chat over what happened.
I think it's a really good way of creating environments of a real cross-section of a community.
I think it's patient-focused, it's centred in practice.
It introduces people to concepts and ideas that they wouldn't have otherwise come across.
The starting point for action learning is a person coming along with a problem or a challenge that they really want to tackle, and that they must be able to admit their own ignorance about that problem. If they think they know how to solve it now, why come to the action learning set?
Hi Dan, well today my name is Sue Heatley. I'm the pre-dialysis nurse specialist at Manchester Royal Infirmary. I was aware that there were more and more patients coming through the clinic who were requesting or opting not to have dialysis. What I was aware of also that there was no specific pathways in place for these patients. So there was no specific support or monitoring systems in place for these patients. I had ideas, I had thoughts, I didn't really know where to take them or what to do with them. I just knew that we had to put something in place and develop something.
My name's Dennis Crane and I'm a renal transplant recipient and patient representative on the Cheshire and Merseyside Transport Action Learning Centre. There are various problems associated with transport. One of the problems sometimes is that patients are picked up with other patients on the same vehicle, and so therefore rather than going what may be a 10-minute journey as the crow flies from their own home to the dialysis centre, they're going all around the houses before they actually arrive. So that can add 2 hours at each end of the actual dialysis session, and it means they're out of the house for most of the day, 3 days a week, which can be extremely tiring and also frustrating for patients. I think the problem has been that the service has always been organised by the people providing it rather than the people needing it. You know what it's like if you're waiting for a taxi to take you to the airport for a holiday and it's 5 minutes late. And you imagine what that's like 3 times a week when you're going for a medical treatment that's actually saving your life, and it just becomes unbearable for some people.
Action learning is more of a discipline than a technique. Its benefits are that it brings people together to solve the difficult problems that they're facing in their work.
Well, one of the key issues in renal healthcare is establishing integrated care plans for people with chronic kidney disease across the whole spectrum of their kidney disease, from at-risk or early kidney disease right through to dialysis, transplantation and end-of-life care. Now, the Renal NSF sets the context for the management of that pathway, but what it doesn't do is tell people how to achieve those standards and quality markers. And what action learning does is enables the people who are providing the service to come together and to reach consensus on how they achieve an integrated care pathway.
I think in pathology we've often looked at problems in isolation really from other areas of the health service. I think the thing about action learning is it brings together people from different arenas of healthcare to share the problem, to share identifying the problem, to share the solution.
My name is Meryl Cracknell. I'm the phlebotomy manager for the Queen Elizabeth Queen Mother Hospital at Margate, but I also look after 2 other sites, Ramsgate and Dover. It's been my belief for a long time that we're wasting a huge untapped skill that we have here with phlebotomists. To actually insert a cannula in someone's arm is a different technique. You have to locate the vein, and that's where our expertise comes in. They could so easily use that skill to cannulate patients when they come into A&E, as well as taking their blood and saving other people a job, like the doctors and nurses. I've had this idea for a long time, but there's never been the chance to actually do anything about it. I have spoken to people in the past, but it hasn't really gone any further. The learning set was my big chance to actually make a change.
When I walked into the first meeting of the Action Learning Set, I thought, oh my God, what is this all about? But it was all very alien to me. It wasn't a directed meeting with an agenda. And I remember thinking, this is going to go on for 3 hours. What are we going to talk about for 3 hours?
The Learning Set meetings take place once a month. We all arrive around about 1 o'clock, and the first thing we have is lunch and a little bit of a chat. And then we sit down and we work our way through the agenda. It's a very nice, pleasant afternoon where everyone encourages everybody else and everyone is pleased at everybody else's progress. If anyone needs help at that point, we decide how we can best help. I think it's a good idea to move off-site for these meetings. There's a tendency, if you're perhaps having a meeting in your own hospital, that you might have a bleep with you or someone can get hold of you on the phone, and you can't really remove yourself from your work, and you need to be able to do that. So by not having our meetings in a hospital and actually going to a local hotel, I think there's a good feeling about that. We are out of our environment and we can really concentrate on what we're doing.
The structure of an Action Learning Set meeting is determined by the issues and questions and problems that people bring along with them. So typically the set has a facilitator who helps the set members divide the time between themselves in order for them to each speak about the issue that they're bringing and be helped by questioning to come up with some useful ideas for action.
The Action Learning Sets are acting at 3 levels. They've come together to address a specific problem, bringing their own views and experiences. They've come together as individuals who will learn from the action learning environment and gain some skills and competencies as change agents. And they're also acting at a level to bring problems from their own particular work arena to maybe get ideas and views to improve quality of service.